Have you ever looked at your older cat, the one who's suddenly tearing through the house at 3 a.m. or just yowling for no reason and just thought, what on earth has gotten into you? It's so easy to just chalk it up to them, getting older and a little quirky. But what if it's something more? Today, we're going to decode a secret your cat might be trying to tell you. It's probably not just a funny phase. Let's dig in and figure out what could really be going on. And that's the classic dilemma for us cat people, right? Is this new kind of chaotic behavior just them? Is it part of their personality now that they're older? Or are these changes a subtle little hint that something's actually medically wrong? Believe me, it can be so hard to tell the difference. And this is what makes it all so confusing. I hear this from owners all the time. This sudden burst of energy. I mean, it seems great, right? It's like a welcome return to when they were a kitten. But that very thought, that's exactly how the real issue gets missed so easily. Okay, so let's jump right in. Let's try to separate those personality quirks from some potential red flags. Because these behavioral changes, they're often the very first signs of a problem, but weirdly enough, they're also the ones we overlook the most. And here's what's so wild about this. Long before you'd ever notice something physical, like weight loss, your cat's whole demeanor can just shift, and sometimes dramatically. That extra sass, that new anxiety, the sudden need to be glued to your lap, none of that is random. It's often a direct result of something medical going on inside. So what exactly are we talking about here? Let's get specific. Is your cat suddenly way more chatty, maybe yowling at all hours of the night? Has your usually sweet, cuddly cat started hissing when you get close? That kind of restless, nervous energy where they just can't seem to settle down? Or maybe they've gone from being super independent to a total Velcro cat? These are just new personality traits. This is often your cat's clearest way of screaming, "Hey, I don't feel right." All right, so let's get to the bottom of all this mysterious behavior. We're actually talking about a tiny little gland in the neck that has a huge impact on your cat's entire body and their mind. So, the condition behind all these changes? It's called feline hyperthyroidism. It's basically when the thyroid gland goes into overdrive. But what does that really mean? Well, think of it like their body's thermostat is broken and it's just stuck on high. It's flooding their system with hormones that control their metabolism. And believe it or not, it's actually the most common hormonal issue we see in cats once they hit their golden years. And just to give you an idea of how common this really is, get a load of this number, 1 in 10. That means for every 10 cats over the age of 10, one of them is likely to develop this condition. That is way more common than most people think. So if you're sitting there nodding along thinking about your own cat, you are definitely not alone. I love this analogy because it's the perfect way to picture it. It's like their body's engine is just stuck in overdrive, constantly redlining. That flood of extra hormone cranks their metabolism up to a level that's just not sustainable. It puts massive stress on everything, the heart, the kidneys, the digestive system, and, this is the key part, it directly messes with the brain and the nervous system. And that is what's causing all those behavioral changes we just talked about. Okay, so now that we know what's happening on the inside, let's talk about the more concrete signs that you and your vet can actually look for. Think of this as you becoming a detective for your cat's health. So at home, the classic sign, the big one, is weight loss. Even though your cat is eating you out of house and home. They're just ravenous. You might also notice they're super thirsty, always at the water bowl, which means, yep, a lot more trips to the litter box. Now, on the flip side, your vet is going to pick up on things you just can't see. We're talking a super fast heart rate, high blood pressure, and they might even be able to feel an enlarged thyroid gland. It's called a goiter, right in your cat's neck. Yeah, this side-by-side comparison, it's just so powerful. It shows the physical toll in a way that words just can't. You can really see that dramatic weight loss and the muscle wasting. Their body is literally burning through its own resources just trying to keep up. It's a really stark visual, and it shows you exactly why this disease has to be taken seriously. But here's the good news. Getting a solid answer is actually really straightforward. It all comes down to a simple blood test that measures the main thyroid hormone, which is called T4. If that T4 level is high, well, that tells your vet pretty much everything they need to know. Okay, so you've got a diagnosis. The question is, what now? Well, the great news is that there are several really effective ways to manage and even cure this condition. So let's break down the options. So, you can see there are basically four main paths to go down. First up, you've got daily medication. This is often where people start. It's a little pill that blocks the extra hormones. It works, for sure, but it's a lifelong, everyday commitment. Then there's surgery, where they actually remove the overactive gland. This can be a total cure, no more pills, but of course it comes with the usual risks of anesthesia. A third option is a special diet. It's a prescription food that severely limits iodine, which is basically the fuel the thyroid uses to make the hormone. And finally, there's what many vets consider the gold standard, radioactive iodine therapy, or I-131. It sounds intense, but it's just a single injection that safely zaps only the bad thyroid tissue. It's a cure, it's super low risk, the only catch is that the upfront cost is a bit higher. Now, picking one of these treatments is so important because, well, doing nothing is just not a safe option. Let's talk about why acting on this is absolutely critical, and then we'll get to the incredible reward you get for doing it.
So this really begs the question, right? What happens if you just don't do anything? If you let this go? Unfortunately, the consequences are pretty serious.
I mean, think about it. The body just can't stay in overdrive forever. It's not built for that. That constant strain leads to some scary stuff. Severe muscle wasting, serious heart disease, and high blood pressure that can literally cause sudden blindness or damage their kidneys and brain. It's like a domino effect of damage throughout their whole body. And in some rare cases, it can lead to an absolute medical emergency. It's something called a thyroid storm. Now, it's rare, but it's a life-threatening crisis where a huge surge of hormones just overwhelms the body all at once. It can cause collapse, high fever, real distress. And that right there underscores why managing this condition is just so incredibly important. Okay, but let's shift gears from all that scary stuff and talk about the reward. Because this quote, it just says it all. Vets, owners, everyone agrees. One of the absolute best parts of successful treatment is that you get your cat back. Not just a healthier cat, but their true personality. You know that constant anxiety and restlessness? It just fades away. The cat who was so irritable and was always hiding, they start seeking you out for cuddles again. The nonstop yowling stops, the frantic pacing ends, and this wonderful sense of calm just returns to them and to your home. You actually get to see them relax, maybe for the first time in years. So we're going to end right where we started. The next time you look over at your wonderfully quirky older cat, just take a second and ask yourself that question. All those little changes you've been noticing, they might not just be sass. They could be a secret message. And honestly, it might be the most important one they ever send you.